happy Tuesday. Hopefully it's Taco Tuesday out there for some of you guys, and if not, it should be. So for all of you guys who are watching, I am Erkeda Durowan. I am a digital health executive who's also a digital health risk management leader. And as we know, healthcare innovation is growing so rapidly. So I've started a series to kind of go over key aspects to the field. And today is really exciting for me because this is my first LinkedIn Live with a guest. So I'm not going to talk about me. I want us to kind of focus on Stephanie Barnes, and I want you to tell us a little bit about yourself and your work.
All right, well, awesome. Well, first of all, thank you so much for having me. This is always, it is always great to talk about digital health. It's something I'm extremely passionate about. And so I'm grateful that we get to have this discussion today. And as everyone can see, I'm Stephanie Barnes. I am a healthcare innovation attorney. I've been practicing law for a little bit over 25 years. I work with Nixon Gwilt Law, and as I always like to say, I am the Atlanta office. We are a completely remote firm, and we serve digital health startups in helping them to scale and grow their businesses. And I am super excited about digital health, particularly how it helps women of color, Black women in particular. And I am just excited to have this conversation today.
Well, I'm excited to have you. And I know that our guests are still pouring in, and they're excited to learn just about like how digital health is growing and how your firm can potentially help them, as well as like what's going on in this space. So during this conversation, we're going to dive into a few questions, and then we'll have some time towards the end of the conversation for people to kind of chime in and ask us things that they've been thinking about or that may have come up. If you think of something during the conversation and you want us to answer it, just put it in the chat and I'll try to get to it. And if we don't have time to get to all the questions, you can definitely leave a message and we'll get some answers back to you after offline. But my first question for you is that digital health has been growing tremendously over the past few years. So we know that there are so many health disparities in the US, like the pandemic has definitely showcased how there are a lot of inequities in our healthcare system. And we know that digital health is so innovative and is working to kind of bridge those gaps. In what ways can innovation in digital health specifically address the unique health challenges faced by marginalized communities? We have a lot of our guests who are advocates for health equity here, a lot of leaders in that space, and I'm sure they're all thinking about this.
Yes, well, this is, a great time for digital health. And, you mentioned how, during the pandemic, many inequities were magnified. One of the great magnifications, I believe, during the pandemic was the use of digital health and telemedicine and telehealth opportunities to expand healthcare during a time when people couldn't physically get to offices. So I think, because I know Morehouse School of Medicine did a study recently where they identified that like during the pandemic, I think it was about 51% of the physicians that were surveyed had never used digital health as a tool for being able to communicate and take care of patients. And so the pandemic actually helped to accelerate that. So that's something that I think, was a good outcome, if you will, from the pandemic, in that it forced the healthcare industry to embrace technology in a way that they had not before. But in terms of how digital health is a tool for reducing health inequities and improving health outcomes is access. Many of us have access or have smartphones or have access to computers, and now this is a way to connect with our providers in a way that we were unable to do so before. I also think digital health has created, or has the opportunity really, to create community, because it literally bridges the physical gaps between people who are experiencing the same kinds of healthcare um, issues, as well as connecting them with their provider. For example, Health in Her Hue is a digital health platform that helps Black women, for example, to find providers, providers of color, and to connect them with others. And there's several other apps out there. The Earth app, for example, that helps women to connect with each other, or just to connect with people who are experiencing the same health journey. I also believe it helps to improve communication. You know, we work with a lot of clients that are in the virtual care management world. And one great aspect of virtual care management, which is where you use technology to transmit data between a patient and their provider, is providers get real-time data more efficiently, more accurately, that helps them to manage their patient's care in between visits. So it improves that communication. Both it empowers the patient with information about their own health care, but also helps their providers to get access to that. And I also think it creates the opportunity for inclusion and representation. And that's something that is very important, not only in the design of digital health systems, if you will, or digital health tools, but also in the use of these tools. And then ultimately, all of this works together to improve the patient's experience as well as to improve their health, because again, they have greater access to their own health data. They have a better mechanism for communicating with their own provider, and they have a community where they can learn from others' health experiences and learn how to empower themselves.
You are preaching my language, because I've been in the digital health space for a while in various capacities of leadership. And one of the key things that we do love to talk about is access.
Mm-hmm.
I think moving forward, we have to think about what happens after we create the access. Like, they're there
Right.
now.
Right.
So we just perpetuating the biases that already exist in healthcare, or are we doing other things like you mentioned, where we're building these communities and we're improving the patient experience and improving patient outcomes? Like you said, there are very niched organizations that are working on that, like Health in Her Hue. I personally have an app called the Pacemakers, which people may have not heard about. I'll put it in the link. But the biggest focus is, how do we provide that education, those resources, as well as build that community? And then when you're doing that from the other side, from the healthcare leadership side, as you guys in your law firm are advising different startups, how do we make sure that health equity is ingrained into every aspect of what they do and is not just an add-on? So
Right.
that starts from the beginning. Like, what clinical team members are you bringing on? Are you bringing on a diverse group of advisors? And how are they working to not just put and say, hey, we gave them access to the app, but what's next? So I'm sure we'll be diving more into that too.
Yes. Yes. Yeah, because it is.
So,
Oh, go ahead.
mhm.
Oh no, I
No,
was just going to say the design and thoughtfulness is such a key aspect of ensuring that the digital health tools do indeed bridge the gaps and don't widen them. But we'll get into that much more as well.
absolutely. Would you be able to share any details or of some digital health innovations that you've seen that have
Mhm.
successfully reduced healthcare disparities, and like what made them successful?
Right. And I would not be remiss without acknowledging that this is Black Maternal Health Week. And so I just want to take a moment to spotlight that and spotlight some innovations that I believe are helpful. I've already alluded to some of them, but I always like to share this statistic. And unfortunately, uh, we get so many reminders of why Black maternal health in particular is such a critical issue. I'm sure all of us, or many of us, are aware Crystal Anderson, the Kansas City Chiefs cheerleader who passed from sepsis after stillbirth, died, recently. And so, it just highlights how, it doesn't matter about your social economic background. Many times you would think that in certain instances, in certain health centers, and once you get to a certain status, that you know, these statistics would improve, but it still remains the case that Black women are 3 to 4 more times likely to die from pregnancy-related causes than their white counterparts. And this is something that I believe digital health is key in improving, because it creates those communities, as I've mentioned. Health in Her Hue allows patients to connect with providers of color. And the statistics show that when Black women have Black physicians, they tend to have better outcomes. So that's really important. The Earth app, as I mentioned, provides those resources that a patient can empower herself with before giving birth, knowing what to ask, knowing how to advocate for yourself. Because not only is it important on the provider side to be able to take care of patients, but it's also important for patients and their families to be able to advocate for themselves. And of course, we don't want to leave the dads out. There is an app that is Dope Black Dads, which is aimed at helping fathers to support their partners during the pregnancy journey. And of course, there are others. Black Mothers Matter, Walomi, there are several out there. But I wanted to just highlight how these digital health communities empower patients, empower providers, and empower us to be have a more active role in our own health.
I love that. And I love that you're highlighting Black Maternal Health Week, because it's so important. Like you said, Black women are 3 to 4 times more likely to die in childbirth as opposed to their white counterparts. And it doesn't matter what socioeconomic status you're at. Like you just mentioned, the person who was recently in the news passing away from that. Even Serena Williams is known for talking about her issues with her first delivery and how she was kind of like gaslit and not believe like that she was in pain. And she actually ended up having like multiple blood clots in her lung. And could have passed away. And personally, one of my friends who went to an Atlanta hospital, who is also a physician who delivers babies, was not listened to and left on the floor for over a day when she was having signs of preeclampsia, and she almost passed away as well. And they were paging the wrong doctor. So this is how healthcare could be improved with technology. Like imagine if your doctor could follow you along as you were going, despite where you were and if they were an outside doctor or not. So there are many different avenues in which we can improve maternal child health. And some of these apps help. And as you said, like building a community definitely helps. So that may be something that organizations and startups and even well-known hospital systems can think about in terms of incorporating. A lot of people are talking about incorporating AI or incorporating these workflows and things, but maybe we could start simple and just think about creating communities and bringing that humanism to medicine, because they can help with the education and the advocacy on both sides.
Right. Because we think sometimes that, like you say, it needs to be something complex, but it's really can be very simple. Because like when you look at what digital health tools are, it's usually either a mobile app, the telemedicine or apparatus, that allows patients and providers to connect using technology, and then the electronic health record. And, all of those things together create or provide lots of information and insight into a patient's health or where a patient is on the health care journey. And digital health, is helpful in kind of synthesizing, if you will, all of that information, because the downside to having all of this information available is a lot of information. So having the right tools that can aggregate data, that can tell the provider a story as opposed to just spitting out numbers and metrics and so forth. But that's why, the design and really thinking about the patient experience, thinking about the provider experience, and using these technologies to pull the data together in a way that helps not only the patient to advocate for themselves, but helps providers to have better insight into what's going on.
Absolutely. Like thinking about ways, like the ultimate goal is to improve patient outcomes. And what
Mhm.
better way to do that than creating that experience where patients are satisfied as well as being taken care of, where there's
Mhm.
evidence medicine. And
Mhm.
thinking about it from another perspective, a lot of startups are thinking about how to become profitable. And
Mhm.
unfortunately, health disparities are so costly to the system. It costs about
Mhm.
$418 billion, they're thinking, just from the misdiagnoses, the poor
Mhm.
care, the bounce backs to the hospital, and all of those things. So if you can create solutions that are tailored towards improving the equity of care as well as
Mhm.
improving outcomes, you're going to become profitable. So it's a win-win, and
Yeah.
hopefully helping people to thrive and survive and live with the healthcare system that they deserve.
Right, right. Because, as you mentioned, profitability is a huge component. And of course, technology costs money. And it is important to not only look at the design side and how the technology can help, but also engaging the policymakers that are influencing insurance.
Mhm.
Because we know that, the United States health system is based off of the insurance that you have. And of course, Medicare and Medicaid are two of our larger payers, but then there are several private payers as well. But if the insurance companies don't cover the costs of the technology, then it is not as helpful, particularly as it relates to improving health inequities. Because if a patient cannot afford the technology, it's not going to be helpful for them. So that's an important aspect to this as well. These two things have to go hand in hand. Not only do the startups need to develop this great technology that's going to help patients, but also look at the reimbursement structure that is going to support it. And that's one of the things, for example, that we do a lot of when we're working with our clients, is not only helping them to set their companies up and have the right documents, but helping them to really look at the reimbursement environment and how they're going to pay for the great technology that they're designing.
Absolutely. Like, I feel as though there are so many opportunities in which you can create these equitable spaces. Like you
Mhm.
said, like, if they don't have the access, if they don't have the technology,
Mhm.
how will they use it? So we're seeing that right now in the news, how in rural areas they're
Mhm.
putting digital health kiosks at the bank, because you're
Right.
going to have a bank. So how, if you can't have the technology available to people with the broadband issues and the digital
Mhm.
divide, how are you meeting them there? I just recently
Right.
gave a talk at Computers in Libraries, and we talked about how we can reimagine libraries to be hubs to improve healthcare equity, because libraries are free. There are so
Yeah.
many different programs there. Why not expand their access and their reach for the people who are in their community, so that they can utilize them for education on how to improve their healthcare
Mhm.
as well as meet those standards? And like you also said, there we have to think about the political determinants of health.
Mhm.
I
Mhm.
love to say that healthcare isn't political, but as we've seen recently in the past few years, it
Yeah.
is. So
Mhm.
it doesn't matter, you're red, you're blue side, whatever. But there are political determinants of health. And there's a great book, and I'll drop the name in the chat, called The Political Determinants of Health by Daniel Dawes.
Daniel Dawes? Yes. Yes. I'm
Awesome.
a
I think he'll
colleague.
be coming on eventually soon. But it really talks about, like, we can have all the ideas that we want, we can have all of the innovations, but unless we are setting up and advocating for ourselves through the way that the government works, we're not
Mhm.
getting those policies that trickle down into the community. So
Right.
we're also seeing now, even with healthcare, we're at a great point where we can create these policies and kind of affect what's going to happen with all of the technology. Biden just released the AI policy for
Mhm.
governance, innovation, and risk management, the safe use. So that was about a week or two. And for you guys who may be following me, I have a little series where we're kind of going through the document. And tomorrow we'll have another LinkedIn Live where we'll be talking about one specific aspect of it, where they're calling for all of the government agencies to create an office of the
Mhm.
chief AI officer. And how this will be revolutionary is it can be help us kind of tailor how to keep things safe for patients as well as equitable, because that's what we need to do as we grow in this healthcare innovation. There's so much opportunity, but there's also a lot of opportunity to go left in terms of perpetuating bias and not promoting health
Right,
equity.
right,
So there's a lot there.
right, right. Because the digital world is often a replica of the literal world, and so of course we know that there are biases that exist in person-to-person healthcare interactions, and it's really important in the design of the digital health tools that those same biases are not carried over. So it's incredibly important for AI developers, digital health tool developers, everyone to really be thinking about the data that is being made part of these tools, to ensure that it is not, perpetuating the power structures, if you will, that have created the inequities in the first place, making sure that it's culturally competent, and also making sure that the data set is indeed inclusive and representative of the patients that will be served. And so all of those elements are important, both at the design phase, as well as implementation and as the tools are rolled out, ensuring that they're constantly updated, if you will, to ensure that it is relevant to the experiences of the patients that are being served.
Absolutely. I think that it's imperative, and it's good that your team can help people kind of navigate through these processes, because it's evolving rapidly, and there are a lot of things that we have to worry about in terms of staying in compliance and regulations and all of the different things. And as you mentioned, it should be a collaborative
Hmm.
experience. So
Right.
how do you recommend that stakeholders across the health technology ecosystem collaborate to ensure that
Mhm.
digital health developments are equitable and inclusive, and that we're pushing for those agendas and the policies?
Right. And we've alluded to some of them, but just to kind of, bring all of this together in terms of what the ecosystem is, of course, there is the underlying policies, and the policies are going to govern, access, how things are done, who is enforcing, who's regulating, how is it regulating, and really promoting self-regulation, honestly. But also making sure that the policy, again, is not perpetuating the inequities that exist now. Also, reimbursement and insurance coverage. Those things have to go hand in hand, because, as I've mentioned, if there's no one to pay for it, then the technology won't be as helpful. Also, infrastructure expansion, because even though, I think the numbers, I think about 90% of people have phones, cell phones. Not all have smartphones. Not all have broadband access. Not all have stable internet access. So the infrastructure is critically important to ensure that the people who really need it, those who are in rural areas or underserved areas, actually have the technology infrastructure that allows them to utilize the technology that's available. And then, having that inclusive design. And so making sure that both from the digital health startups who are putting the technology out there, those who are purchasing it, the customers, whether it's a health system, a hospital, or insurer, but and of course the ultimate patient, making sure that you have these stakeholders represented in the conversation. And I think it's really important for patients to be at the table, either literally or through their representatives, and making sure that the the lawyers who are representing these companies, are asking the tough questions, and ensuring that the needs of the ultimate end users are being met and considered. So it's none of these things can happen in isolation. It needs to truly be an ecosystem where the different elements are indeed working together, and not working, creating friction among themselves.
Absolutely. I couldn't agree more. Like there are so many barriers, but we can work together to decrease those barriers and make it easier for
Mhm,
people to innovate and easier for people to get the care that they deserve. Like you said, I love what you said about patient side also in the perspective. There are some
mhm,
patient advocacy groups that are coming together for responsible use of AI, responsible use of healthcare innovation, and we need to continue to bring them to the table as well.
mhm. Right, and not, solely focused, because obviously with any technology, there's going to be downsides, but
Mhm.
really focusing on how to truly optimize the advantages and how to lessen the risks that may exist. And so it's really important to, be proactive in how we even think about the rollout of these different technologies, and to constantly evolve our thinking around ultimately taking care of the patient, because as I mentioned, I've been practicing law for almost 25 years, a little bit over 25 years. And when I was in-house a general counsel for a health system, I used to always think that even though I never physically took care of patients, I was never at the bedside, that my job every day was to take care of patients. And I think, we can't lose sight of the end user in every technology that we develop in this space is a person, is a human being, and really having that person's well-being in mind as we are designing the product, as we're developing the policy, as we are developing the reimbursement structure around it.
Absolutely. Like we have to continue to have the humanism like implemented into medicine. Like you said, we love to work in silos, especially in health tech,
Yeah.
where
Yeah.
everyone is a subject matter expert in something. And there's like, oh, there's the clinical vertical, and there's the tech vertical, and there's the business aspect. But we all need to come together and collaborate early, as well as
Mhm,
bringing our collaborators with the patients and the people who are the end user at mind, so
mhm.
that we can create systems that work well and that have that insight. So you can have the best product out there and that you think, and then when you bring in the clinical component, they're like, well, did you? We can't do
Mhm.
that with HIPAA, or do you know we have
Right.
to the allergies every time? It doesn't matter if the patient doesn't feel as though it takes some clicks, extra clicks every time, and
Mhm,
they've told you before. We have to implement things that are safe. So
mhm.
figuring out ways in which we can bring people together is definitely something that we need to do. And I see that Amy just agreed and said yes. She thinks that it's important to work with talent that are chronic patients, but also
Mhm,
designers, engineers, developers in all walks of life, because we
mhm.
we definitely have to come together and kind of create this coalition of people who are different subject matter experts, and they may not even be in healthcare, but everyone who has been born will kind of come in contact with the healthcare system. So we
Right.
have to make sure that we're hearing their voices. And I love that you mentioned chronic pain, Amy, because there it's an invisible disease. And
Mhm,
it patients are gaslit because of it. Patients are at work and they're struggling, and the employers need to figure out ways to improve the benefits. And we need
mhm.
to have some more tech advances both to treat the pain and to help you cope with it. So thanks for putting that comment out there. And for anyone else who has any comments or questions, we have a few more questions left, but we'll leave a little time for you guys to ask them, if you want to just put them in the chat. So, as we know, in terms of the tech space, women are really
Yeah.
underrepresented,
Yeah.
grossly underrepresented. And we've been seeing that there have been some policies kind of pushing forward in terms of the White House initiative on women's health and women's innovation and research. And we've known that even up until the 90s or so, women weren't even allowed to participate in clinical research. So we're really behind in terms
Come
of
Yeah.
the medications, the treatments, and everything that we can do to focus on women. So, can you share any insights or data on the current representation of women, especially Black women, because it's even lower
Right.
in the digital health startup space?
Yes. Well, I'm going to share some statistics. I wanted to make sure that, to really emphasize how dire really this issue is. So, like right now, about 40% of the digital health companies are founded by women. or 40% of the digital health startup companies um, founded by women are venture backed, meaning they have venture capital funding, as opposed to 62% being of those founded by men having that venture backed capital. Black women in particular, are more likely to bootstrap, meaning they're coming up with their own funds. About 57% of the digital health companies that have Black women founders are carrying that load themselves. And it's not just at the founder level, it's also just in the health tech space. About 25 to 30% of healthcare executives are female. And about 13% of those are CEOs, the decision makers. And then when you get to looking at the venture capital companies and those that are led by women or led by Black women in particular, that number gets even smaller. So in 2020, only about 20% of all global startups had a female founder, and the average size of a venture capital deal of all female teams was 6.8 million compared to 18.7 million for male teams. So you can just see that disparity. And this number has varied between 2020 and now, but it's still about the same. It's only about 2% of all the venture capital funding went to women across the U.S. And for Black women, it's not even a 0.5%. It's sometimes you see the number as 0.25%, 0.35%, but we don't even get a 0.5%. So when you look at just the representation of women who are in this space, we've got some room to grow. And that's how I'd like to look at it. Because right now we have Iman Abuzed, who is with Incredible Health. She's a co-founder and CEO. She is one of the few unicorn Black women founders for the unicorn startups. And her company is presently valued over $1 billion. And she's one of 9 Black and Latino female founders who have reached that status. So as I'd like to position it, we have a lot of room to grow.
Absolutely. Like there's so much space for innovation, and especially with all of the initiatives for women's health, they probably should be led by women. I definitely see that now. I am the chief medical officer of an organization focused on women medication adherence called Emmy. And it's an interesting space. And I'm excited to see the growth, because there are so many startups that are coming forward that we definitely will, I think, kind of take it over for say it myself. No offense to the men that are watching, but women's health is something that needs to be addressed, but not only women's health. Like, why can't women lead in other spaces? So
Right.
making sure that we have equitable funding and that we are kind of working to overcome these gaps, but that also comes with some of the other leaders in terms of mentorships and venture capitalists looking. So if there are any companies out there like this list of people that are at this event, hopefully they're saying hi to you guys. Yeah. And maybe we'll start kind of connecting people to see what they can showcase.
Right, because the representation of women in women's health space is critically important, because as you alluded to, women are not even, or have not been historically well represented even in the clinical research. For Black women, Black people in particular, that number gets even less because of distrust issues that have come from over the years of where clinical research was not done to our advantage, where we were actually harmed by clinical research. And so it's just so important for us to literally be at the table, whether that is funding, design, or leading. So it's critically important for more women to be leaders in this space, in the whole spectrum of the ecosystem that is promoting and ensuring that women's health remains at the forefront of digital health startups or digital health industry.
Absolutely. And as we just mentioned, there are definitely inequities in funding for women,
Mhm.
especially women of color. And of course, we know just in the workplace in general, there are a lot of other responsibilities that may allow it to be more difficult for women to navigate the terrain of being a startup or a digital health entrepreneur.
Mhm.
We definitely do have digital health growing in hospital systems and urgent cares and larger systems, and there are women in leadership there. We need more. But for the founder space, aside from some of those challenges that were just mentioned, can you think of any more? And how can these challenges be overcome from a legal standpoint or with a partnership with an
Mhm.
organization like yours?
Right. Well, I think it's really important. The funding is going to be the critical issue that remains a challenge. And some of it has to do with access to the venture capital funding, making sure that Black women in particular or women get in front of the right investors or investors who are willing to support women's health. So that's key. Two, I think, is just the ability to know how to protect yourself in terms of even how to set your company up. Because as I mentioned, many of the Black women founder led health tech companies are bootstrapping it, meaning they are coming up with their own money. I mean, they're supporting it themselves. And so when they don't have access to that capital, they may cut corners on some of their legal documents or not have access to the right um, infrastructure to help them build their companies in a way that allows them to grow and that positions them well for investors once they are ready for that stage. So I think, one, having the access to the funding, two, understanding corporate governance is a term we use to describe how a company is set up, how your leadership is set up, what documents you need, but making sure that you have sound corporate governance so that you're making decisions to protect your interests, to protect your ownership, and also to protect your ability to make decisions on how and when the company grows. So I think those are key aspects to ensuring that women founders, Black women founders in particular, are positioned to be able to grow their companies.
Absolutely. I think that that's so important and just showcases how innovation law groups can kind of have that niche and
Mhm.
specifically help founders kind of protect their like structure their
Mhm.
business, protect their innovations and their intellectual property and things
Mhm.
like that.
Right.
So I love it because a lot of times there are there are healthcare lawyers and then there are innovation healthcare lawyers, and there's a
Right.
difference. Just like with physicians, there are certain employment lawyers that focus on general like employment, and then there are some that are specifically niche to healthcare
Mhm.
and some that are specifically niche to digital health.
Right.
So learning how to navigate those waters could be interesting for anyone in a startup, but definitely looking to find organizations that can support you that actually know the
Mhm.
arena that you're working in is so important, and it can be something that can cause even more loss of funds as you're working to invest in finding the right partner.
Right, right. Because one thing, that is particular about digital health startups that their non-healthcare counterparts may not deal with is, the regulatory environment for healthcare. Because there's some things that you absolutely can't do, and if you set your customer agreement up in certain ways, you can actually create criminal outcomes. So you definitely want to have an attorney that really understands healthcare and understands how these referral relationships have to be structured, what is an appropriate payment structure and what will get you sent to jail, but also, again, understanding the regulatory environment in a way that allows you to be innovative. Because there are some healthcare attorneys who kind of take a very conservative um, and strict approach to risk. And obviously, there is always risk involved in these deals, or in terms of just when you are interpreting regulation and applying it to a business model. But it's really important to have an attorney that understands the breadth of the regulations and how you can be innovative in that space, and this is important, and remain legal. So that is yes, that's key. So it is really important to understand the healthcare regulatory environment, so that when the you get to the point of developing your payment structures, your business model, your customer relationships, you do so in a way that is compliant and will truly allow you to grow, and in a way that you're not going to be taking excessive risks, or taking a risk and not really knowing it because you don't understand the regulatory scheme.
I couldn't agree more. Totally not a lawyer, but being a person who is risk management certified for healthcare, as well as a clinician who's led at several digital health organizations, it's a different ball game. And a lot of the startup leaders may not have experience in healthcare,
Mhm,
and like you have a great
mhm,
idea, you have a great way, you have some funding, but
mm,
healthcare is a different space. So as we've seen with some of even the larger conglomerates like Amazon, who's
mhm.
gone into healthcare, CBS, who had to take down their health equity focus like research and things like that, and more companies that are coming forward that are kind of shutting it out. Like, just because you have money and you have leaders who are doing great in business doesn't mean that you can navigate healthcare well. So you need to partner with people who know the regulations, who know
Right,
risk, who can help you optimize workflows, and who can help you kind of see where your gaps are, and who
mhm,
have seen it in different parts of the specific industry that you're in now, not the
right.
industry of you doing Uber, but the industry of healthcare.
Right, because there are some things that are perfectly legal in other industries that are perfectly illegal in healthcare. And it's so important to understand the difference, and to really structure those compensation arrangements, those payment arrangements, so that you have a compliant business model.
Absolutely. And for my final question for you, since you've shared so many like pearls of wisdom, I want to know what message you would like to leave with our
Mhm.
people who are viewing it now, people who may be viewing it 2 weeks from now. If you're looking at this and you think that your team could benefit from watching it, it will be posted on LinkedIn here, as well as the YouTube for my organization, Digital Risk Compliance Solutions. And if you want to share it with them and share the wealth. But what message would you like to leave with our listeners about the future of digital health, innovation, and equity?
Well, the first message that I want to just reiterate, I've alluded to this earlier, the especially for women's health, the global femtech is often a word that is used to describe technology that supports women, but the global femtech market is a growth market, and it's grown from, I think, what, 32 billion in 2022, and continues to grow at a rate around 15%. So I mean, it's not stopping. This is something that is available, and we need to be responsibly part of the growth. And I think one of the things that really symbolizes is how important women's health is. I mean, we are our own financial ecosystem as it relates to, our health, and the market that exists to help us be healthier at every stage of our life. So that's the first thing, is that I truly believe that digital health will continue to grow. Femtech, women's health is definitely on the rise as well. The second thing that I want to just stress is how it is important for digital health to be a part of bringing marginalized communities into the healthcare fold, making sure that we have access. And that means we must be at the table. And whether that's at the design table, the policy table, the leadership table, and definitely the reimbursement table, making sure that these technologies are covered. And the last thing I'll just say is, digital health really has the opportunity to reduce health costs. As you alluded to earlier, when we are empowered with our own healthcare, we're able to make decisions for ourselves earlier. Our providers are able to make decisions for us earlier that keep us from more adverse medical outcomes, readmissions, hospitalizations to begin with. So when we are able to capture our data in a way that tells us our own health story and we're able to use it in real time, not a lagging indicator, but something that allows us to use it as we're going through the healthcare journey, it will not only reduce the costs for us as a patient, the insurance companies, the providers that are taking care of us, but it will reduce the costs and inefficiencies for ourselves. So we need to continue to advocate for digital health as a tool, as truly a tool to bridge the gap between marginalized communities and their providers, and just among the people who make up the healthcare infrastructure or healthcare ecosystem, and ensuring that we are using this tool to educate ourselves, to empower ourselves, to advocate for ourselves, and ultimately to improve our own healthcare outcomes.
I couldn't agree more. I really appreciate you for joining us and sharing all of your insights. Um, for those who are listening, I'm going to put Nixon Gwilt in their website in the chat. I would love for you guys to post any questions that you have in our last 5 or 10 minutes. And as we can see, there's so much hope for healthcare. There's so much hope for healthcare innovation. It's growing. There's an opportunity to positively impact lives of populations while we're harnessing technology. I'm going to just do my little shameless plug that AI is having a moment. We talked about it earlier. There are policies that are in place now that will be enforced over the next several months by the end of the year. So I'm going to be talking about how to utilize a fractional AI officer tomorrow. I'll put the link to the chat in there if you want to join it. I'll be solo dolo, but we can have some fun talks. And I just want to appreciate you guys just showing up and asking questions. We do have one question in the chat now. I just put the law firm's access to the website on there. But Amy asks, what are your thoughts on the commercialization of health, the pros and the cons?
And before I answer that, I do want to put a shameless plug. Please, when you go to our website, sign up for our newsletter. We have very great information that's sent out. It's very timely, digestible. So when you go to the website, please make sure that you sign up for our newsletters. So in terms of the commercialization of healthcare, what are my thoughts on the commercialization of healthcare? And are you referring to like how it's paid for, or what aspect of commercialization are you curious about in particular?
We will wait and see what Amy replies, but I think that's a great question.
Yeah.
And if anybody else has any more, we have probably a few more minutes left. So feel free to drop those in the chat as well while Amy clarifies.
And I'll share some thoughts while she's doing it, because the commercialization of healthcare can have so many different meanings, and we've alluded to this earlier. How at the heart of the healthcare relationship are people. It's a person, a real life person that's being taken care of, and I know that most of my career, when I was in-house, and even the first part of my career, I worked for nonprofit health systems. And there would always kind of be this tension around for-profit healthcare, entering the space, and the concerns that profits would have a greater priority than patients. And I think, regardless of what spectrum of commercialization that we experience, it's so important to remember that we're taking care of people, human beings. And so, even from just the regulation of the devices that may be used, ensuring that we're having taking into consideration the impact that has on live people, and what does it really mean to bring this technology to life. And I think profits are very important, because even for a nonprofit organization, no margin, no mission. So it's important that we are financially savvy about the digital health tools that we bring, because very realistically, somebody's got to pay for it. So making sure that it is affordable, that it is actually effective, so that insurance companies are willing to invest, if you will, in reimbursing for those devices, or for those tools, or for programs, or just whatever digital health opportunity is available. And making sure that, again, as we're building the business model, that we are building it responsibly, so that it does have the impact to reduce healthcare costs, to reduce inefficiencies, and to improve the quality of lives of the people that are using the technology.
I think that you answered her question, and I completely agree with you. She had wanted to know about commercialization of the platform and technology, but I think
Okay.
you covered that.
Okay.
Is any more questions, or did you want to clarify any further, Amy? Okay.
Yeah, and I'll just say one other thing, just that any digital health startup has to keep in mind is, who is the customer? Is it direct to consumer? Is it an insurance company? Is it a health system? And really making sure that you really think about who's paying for it as you're designing it, because that may impact how the product is delivered, or it definitely will impact how you set up the customer agreement, or just the reimbursement. Because if it's not covered by insurance, then it's something that a patient's going to have to pay for directly. So where's the value and affordability as you are designing that?
I love that. Well, once again, I truly appreciate you for joining us and sharing your knowledge about digital health, the space, the landscape, as well as how we can better structure our organizations to focus on health equity as we utilize technology. For all of those who are out there listening, I've placed the website for the law firm if you want to use it for your organization in the chat. And if you have any questions, I'm sure you can reach out to us on LinkedIn. It's under our names. So it's been a great hour, and I appreciate you guys for taking the time during this busy Tuesday that feels like a Monday to hang with us. So have a good day.
Thank you, and y'all have a great day.